So welcome to the CACC-NBC Fall Innovation Roundtable. We've got lots of great presenters here for you all today. Please know that the session is being recorded, and also want to acknowledge all of us that are joining today from the traditional and unceded territories of our First Nation. We'll start off with a group from Vancouver Coastal. So Alison Parker, Brandy Dan, Ellen Natras, and Jessica Key are going to present cultural safety, cultural humility, and anti-racism competency tool.
Sybil, and thank you for the invitation to be here and to present some of this work that we've been doing over the last year. So myself, Alison Parker, Ellen Natras, and Jessica Key were all involved in the development of the Vancouver Coastal Health Indigenous Cultural Safety Competency Tool. And so we'll just go through what that work looked like and what it looks like for our colleagues. I would like to, just before we get into some of the content, I would just like to acknowledge as well the territory that I'm calling in from. My name's Brandy Dan. I go by the pronouns she, her. I am grateful to be allowed to live, work, and play as an uninvited guest on the traditional, unceded, and occupied territories of the Musqueam, Squamish, and Tsleil-Waututh for the last about 20-ish years. I am keenly aware of the beauty of the land that I walk on daily, and I understand the importance of recognizing the three host nations who have stewarded this land since time immemorial. I also want to recognize the power and privilege I hold in my identity as a heterosexual woman of mixed ancestry. It is my responsibility to reflect and recognize that my worldview is slightly different and just my own from other Indigenous folks. And I also hold power and privilege in my career that I'm a registered nurse. I hold the position of an educator in a large healthcare organization. And so this is why I give gratitude and position myself in these three host nations territories, and I try to bring that understanding into my practice, my daily practice and role at Vancouver Coastal Health. So I invite everyone wherever you're calling in from to do that intentional territory acknowledgement of recognizing whose land you're on and what that means for you in your professional and personal lives. Yeah. So what we're going to cover today, we would like to introduce the Vancouver Coastal Health Indigenous Cultural Safety Competency Tool. We'll review and discuss a bit of the philosophy and the intent of the tool, and then also engage in questions and hopefully we can give you some answers and inspire you and invite you to join in this process. And I'll just pass it over to Jessica Key.
Great. Thank you. Thank you, Brandy, for starting us off in a good way. As Brandy said, we've worked together within our Vancouver Coastal Health to develop this tool, which we'll get into the details of in a few slides. But the reason why we've put in this work, and we were asked to do this work, and we've had a great support from the organization to put our time and energy into creating this tool, is largely due to Vancouver Coastal Health's commitments to addressing anti-Indigenous racism within the healthcare system. I'm sure many folks have at least heard of the In Plain Sight report, which was released in November of 2020. In that report, it was detailed quite explicitly that anti-Indigenous racism is prevalent throughout all healthcare settings and systems throughout British Columbia, whether that's in acute care, critical care, community, anywhere that people are accessing healthcare, there is anti-Indigenous racism at play still today. This is not an issue of the past. This is not an issue of over there. This is very much the system that we are all living and working in. And as actors in this system, we have responsibility to address the underlying kind of attitudes and issues and kind of the colonial legacies that are informing this racism that Indigenous people are experiencing, and work together to build a better system moving forward. So the really wonderful thing is that Indigenous cultural safety is actually very much aligned with so many kind of goals and values of our professions as healthcare providers and healthcare organizations. So these are kind of the overarching values from Vancouver Coastal Health. We care for everyone. So Indigenous cultural safety is an essential piece of how caring for Indigenous people can be safe and effective. It's an ongoing learning journey that's career-long, lifelong, and it's a challenging, sometimes uncomfortable work, but it is the best way forward for everyone. And so that's how we're going to get to a place where we're providing excellent care that we all strive to provide. We're also kind of in this like really dynamic and exciting time in the work of anti-racism, of cultural safety and cultural humility. And just in February of this year, the Provincial Nursing College in BC, so BCCNM, and in partnership with the College of Physicians and Surgeons of British Columbia, they co-released a brand new practice standard identifying that it is now an expectation of professional practice that physicians, nurses, and midwives are practicing in a culturally safe manner. So we took these standards as kind of the building blocks for the tool that we created, so that it is in alignment with with the work that's being done kind of provincially, and aligning with like the best practices that we are aware of from our practice, from our elders, from our leaders, and kind of bringing it together into one place for for everyone to be able to access. And yeah, so it's exciting that this work is being done kind of at all these different levels. But sometimes when standards come out or practice guidelines and things like that, it's the big idea is there, but sometimes the granular, how do we get there, and the map of what's needed isn't totally clear. So that's kind of where this tool comes in. So we've all heard in our lines of work, in our daily lives, that our clinical colleagues really want to be providing safe care. That's why folks are in practice. Like, we care about people. We want people to receive the best care possible. And it's hard. Like, we are working in such a hard environment, and we know that everyone's stretched super thin. So there's there's a bit of a gap and a need for that that roadmap, that how do we get there, and how do we get there together. So we started working on this in January, and we have tried to take a kind of a culturally safe lens in developing this work. So it looks a little bit different than a competency tool that we might see for different skills or practices. And we've tried to challenge some of the assumptions that are inherent sometimes in the ways that we communicate, and the ways in which we teach and learn together. So it's a really neat tool, and it's embedded and aligns with the work of the Indigenous Health team with Vancouver Coastal, and we'll get into that, I think, next. And I'm just going to pass that over to Brandy, if that's okay. Thank you.
Thanks, Jessica. So when we started this development, we were looking at, we were having conversations about what that decolonized lens would look like, or that kind of two-eyed view would look like to this tool. And so we thought about the cycle of learning and what that would look like with reflection to utilizing Indigenous worldviews like the medicine wheel, so the 4 human needs, the 4 seasons, the 4 kingdoms, the 4 medicines, and how that can actually translate into clinical practice. So when we think about the 4 R's, so respect, relevance, reciprocity, and responsibility, we came up with the idea, well, we knew that the learning was going to be unlearning what we already knew and relearning in order to be able to provide culturally safe care. So as Jess has mentioned, and we will throughout the presentation, this is ongoing learning. And the idea, we struggled quite a bit with the idea of reaching that expert or the full competence of being a culturally safe practitioner. And so we wanted to move away from that and focus on the idea that it was going to be that continual cyclic journey, always looking for new growth, always looking at reflections. So taking in a bit of the theory, embedding that into your practice, and then being able to step back and think, how did that affect me, and how did that affect those that I'm providing services to, and then again going through that process with every cultural or every indicator, every provision of culturally safe care. So that's kind of where we came up with this cycle of learning. And this also, our tool aligns with the Indigenous cultural safety framework. And so we utilize this a lot in our work as well. And I'm not sure if anyone has had access to the competency framework or not. It's being used within Vancouver Coastal Health right now. Hummingbird level is what we have available and out on Learning Hub for the start of that journey, the start of the cultural safety journey for everyone. When we think about going through the levels of attaining competencies, we really liked the idea of pulling this framework in. So when we think about people will start, many will start from no experience and having no knowledge or awareness about this. And I think that for many, that will be a hard place to start on this journey, but that's why we are asking for, you know, genuine commitment to going through this journey together as an organization and as healthcare providers, and being okay with starting out with no experience. And many people will move through the different levels, and many will come back to the no experience or hummingbird level in various experiences or interactions with patients and clients. So in the hummingbird level, this is the self-reflection and spreading of knowledge. The hummingbird is like a new learner, maybe taking small steps, just recognizing that there's racism and discrimination around in our workplaces and our outside of our workplaces as well, but just being able to recognize those moments and starting to be able to take steps in mitigating the harm that patients and colleagues are experiencing from that racism or discrimination. At this level, you know, you need to be very open to learning and come to the education or the learning journey in a very humble way, because many of us are experts in certain areas, and to come back down to novice or no experience can be very difficult. The next level is the frog level, and this is transforming and leaping forward. So if you are in the frog level, you are essentially, as it says, leaping forward. So you're taking big steps. You have a lot of confidence in your culturally safe practice. There's a lot of movement and application of culturally safe interactions. You're able to share knowledge with your colleagues and those around you, and you're understanding the power that you carry in that knowledge and the power within the organization or the health authority. And really in this level, we're learning how to apply ourselves and how to apply that culturally safe practice. The next couple levels, so there's 5 in total. So at the salmon level, you're swimming against the flow. So you're very strong, you're focused, you're driven in this culturally safe journey, and you're trying to carry along those colleagues with you by, again, always sharing knowledge and encouraging others to self-reflect as well, and really trying to push back against what are those unsafe cultural norms that have developed within our practice or within our organization, and really being able to call those moments out and see how we can again look at the systems change or organizational changes to provide culturally safe practice. And in the Eagle level, really you're soaring, you're effortlessly and gracefully applying Indigenous cultural safety in all that you do, but you also have this broad view of what that looks like and how that can be implemented, not only in maybe in just your unit or your team, but the organization as a whole. And at this level, you're able to step up to all levels of the organization. So whether that be frontline or leadership, and really hold everyone accountable, and really be able to push that disruption and that unlearning. And in this framework, we again wanted to pull in the cyclic learning, and not give the idea that you would be expert after you've reached the Eagle level. So we wanted, and this was done very intentionally and thoughtfully over I think a week or two of, do we want to not let those users of the tool reach an expert level and feel that they had attained what they needed to in this culturally safe journey. And it was decided that we wanted to again reiterate that this is a constant ongoing learning journey, and that we needed folks to be willing to re-engage constantly, and maybe go back down to the novice or the hummingbird level, and then work their way again up to salmon and eagle levels. Yes, so this is the framework that we used to guide some of the tool work, and we used it, as reference material as well. Jess, I'm not sure if you'd like to speak to using the tool, or I can keep going.
Sure, I can jump in for a moment. So in terms of specific steps or algorithms to follow to master to, be able to deliver culturally safe care, because that's not really how culturally safe care works. It's more of I pulled the core competencies that were identified in the practice standard from the BCCNM and the CPSBC, and then which are things like self-reflective practice, building knowledge through education, anti-racist practice, creating safe healthcare experiences, person-led care, and strength-based and trauma-informed practice. So under each of these core competencies, we've identified a series or a slew of indicators. So there's a whole bunch of different indicators under each one, and a user of the tool would go through and pick, maybe 2 or 3 that really resonate with them in that moment where they are at in their journey, that they want to work on, or that they, that really makes sense for them, or whatever, and they would pull those into their tool. And the indicators, we'll have a bunch of examples kind of on that, I think the next slide. And then we've also identified for each indicator different learning and action resources. So whether that's some educational resources, some webinars, some online modules, or reflection questions or practice suggestions are all listed and available for folks to draw from, so that they can kind of build their own path that makes sense for them, and then they can continue building on that as they go through their journey. And the way that this relates back to kind of the competency framework is that, again, that people can empower themselves in ways that make sense for them to build their confidence and their capacity to achieve, say, the Hummingbird level, and being able to be more aware and more knowledgeable, and building their confidence in through knowledge, or through small actions, or through big action. I think that this helps to reflect that this journey is deeply personal. Everyone's starting from a different point. The experience that someone is going to have in different settings, different communities, different, their own different identities, it's going to look different. And there are commonalities for each journey, and we can walk along together and support each other. But it's a continuous and ongoing, and kind of this beautiful dynamic living thing. And so this is what the pages of the tool look like. So we've kind of got it broken down. You've got the core competencies in the column on the left. In the middle column, we have kind of like your self-assessment. So that would be in your self-assessment, are you at the, no knowledge? Are you at Hummingbird? Are you at Frog? Wherever your own self-assessment is. In the column on the left in the blue, that's where you would pull the indicators that you're going to work on into. And then the learning actions and learning strategies and actions are in the right column. And sorry, Brenda, I'm going to hand it back to you.
No worries. Thank you. Yes, so this is where this column over here would be where we would take some of the indicators from the tool, and I'll show you a couple slides up. Actually, I can go there now. So a couple slides up. So these are the core competency indicators and suggested learning and action priorities. So you would select one of the indicators from the columns, and you would bring that back to this area. So you would fill that in. We gave a couple different assessment dates because, again, as we mentioned earlier, we want this to be ongoing learning journey. And, as we know, other competencies are usually, yearly or every 2 years. So we want to be able to come back and give those times for reflection and reassessment. And then these were the actions or accomplishments that someone would select from the tool. And so these core competencies, again, are reflected the same throughout. So self-reflective, building knowledge through education, anti-racist practice, creating safe healthcare experiences, so that safe environment, person-led care, relational care, and strength-based and trauma-informed practice. So throughout the tool, as we were saying earlier, like, this is not a prescriptive standard or competency to meet, and the way that it was developed was so that it could support any and all, preferred learning modalities as well, because, when things get prescriptive, sometimes we can be not as engaged. And because of the content of this tool and the Indigenous cultural safety journey, we wanted people to be as engaged and intentional with this as we would like to see with culturally safe practice. So this is how we have, I guess, outlined the choose your own journey or choose your own path. We've set out the core competencies in the left-hand column, and many of these indicators fit into various areas of the core competencies, and there's a lot of overlap in those areas. So as we were developing the tool, we were thinking of a way that we could concisely convey that the indicators could fit in different areas, and it wasn't just one way of thinking to fit into the competencies. So those indicators are, sorry, those suggested meeting the core competencies are on the left-hand side, and then the indicators in the middle. And then as we were talking about with that cyclic journey, we've offered some theory and then some intentional reflections and then actions, what that would look like in your practice, because many of the questions that we do get are questions are, how does that play out into practice and what does that look like for us? Because it's really, it's hard to take that theory and that idea and translate it into practice. And there weren't very many tools out there to do that. So we tried to be, you know, succinct, but also give a wide breadth of options for various people. Yeah. So that is essentially what our tool is. And I think next steps for us, it has been waiting to be to go live. It'll be housed on Learning Hub, and we're hoping that that will be accessible. It'll be housed together along with the Hummingbird level curriculum for Indigenous cultural safety. Jessica has graciously provided a how-to video that will go along with that. And so folks who are going into start the competency tool will have a little video there to kind of guide them through that. We want to be able to obviously get it as widespread as we can so that people who are looking and who are ready actually to be in this journey have the tools needed to do that. It is, we didn't know when we were wrapping up if it was like if this is what it will always be, and we decided that probably not. It will be a living document and it will change as things come out, and we will try and keep, we will be keeping that updated and relevant to cultural safety for the organization. Yeah. So that's kind of what we have for presenting the tool. And I just wanted to give a couple minutes for each of the our co-developers to maybe just reflect on what their experience was like throughout this journey of creating this tool. Allison, did you want to go first?
Sure, I can go. Thanks, Brandy. Thank you to Brandy and Jessica for presenting our work. I just have a couple notes here. I do want to say that it was a great honor to be a part of the group working on this competency tool. And I give all the credit to the Indigenous Health team for recognizing the need for this resource. I'll also be honest and let you all know that as a white settler, I really questioned multiple times throughout this process my suitability to be a part of this work. But I know we've all brought our own perspectives, areas of experience. And as I learned from one of our Indigenous health leaders here at VCH recently, there is real power in collaboration. I'm happy to say that one of the challenges, as Brandy kind of alluded to, we had was sorting through all, the amazing, really really great resources that are out there to put them into the tool as resources for people to kind of have at their fingertips. And I've been very grateful for all that I learned as a part of the work. So that learning happened in collaboration with the group and also on my own as we did our own work. And I'm personally looking forward to using this resource when it's launched to help guide my own ongoing learning journey. And I'd also just like to acknowledge and thank this group for having us here to speak about this work. So thank you, and I'll turn it over to Alan.
Thanks, Allison, and thanks to my group, and thanks to this group. So my name's Elan, and I'm of mixed settler ancestry, and I'm not a nurse. I was trained in Treaty 6 territory, which is also known as Edmonton, and I took my training there to be a respiratory therapist. So this tool was the creation and the start of this tool I had an interesting parallel happening in my life. I recently completed my master's, and my research question asked, what do allied health leaders need to improve Indigenous cultural safety competencies for themselves and their teams? And one of the main recommendations was people needed a tool. They didn't know where to start. They didn't know what the competencies were. They were kind of, had best intentions and operating in the dark. So when I was invited to participate in the development of the Indigenous cultural safety competency toolkit, I was very, very honored, and I was very pleased. I was honored because I felt that this is some of the most important work that I could ever be involved with, both personally and professionally. And I was really pleased because the inclusion of a non-nurse to this professional group, I think, demonstrated an organizational understanding that the work toward improving Indigenous cultural safety competencies is relevant across all professions, through all levels of the organization. From our COO to the operations managers, to all clinical nursing staff, all allied health staff, all people that provide support within the walls of our organization, the greeters, the people that change the light bulbs. This work is really important for everyone. And although we were kind of guided by the principles coming from the Nurses College and Physicians College, really the lens that we brought to this work is that it's for everyone. And I'm happy to have joined this learning journey, and I invite all of you to join the learning journey, and it's one that will last our lifetimes. So very happy to be involved. And Jessica, did you want to carry on? Or Brandy?
Hey, I can jump on. Just handing off a screaming baby. Thank you, Alan and Allison. It's been such an honor and pleasure to work with the both of you on shaping out this work. I am, like I said, I'm one of the Indigenous nurse educators. I'm a registered nurse. My background is in youth mental health and substance use. I'm also Musqueam, and mixed British heritage. My dad's side of the family is from Musqueam Nations, and we're from the kind of south central coast of what is now called British Columbia. This work was really important to me to undertake, and it was when I was asked to work on this. It was really exciting. I was also working on my master's and nursing, and I was trying to look at what is culturally safe care. Like, we hear about it, we've got these directives, we've got these commitments, we've got these calls to action, but it's really, really unclear what it means for practitioners on the ground, in the front line, who are doing the caring and the delivery of care. And there's not a lot. There's a wide agreement that we need to be, pursuing Indigenous cultural safety and anti-racism in healthcare. But the map and the steps of how we're going to get there is really left unsaid in a lot of the literature and a lot of the policies and a lot of the documents that are out there. So this is kind of one small piece of that puzzle that we're hoping supports practice and helps our colleagues along that journey, and kind of helps wrangle some of the amazing knowledge and resources that are out in the world into the hands of the people who can benefit from it. So thank you very much, and I'll turn it back over to Brandy.
Thank you, Allison, Ilan, and Jessica. I can't convey enough, and not enough times, how great it was, how safe it felt to be in this work with you so I just want to say thank you very much. I also want to borrow 30 seconds from everyone's day. I know I'm cognizant of time, Sybil, but I do want to ask just for everyone to take a really, really deep breath and take 30 seconds just to find through this presentation one small piece that you'll be able to take into your clinical practice. I hope that a few of you are as excited as we are that we have this tool, and we'll be able to have some guidance on this this amazing journey that I'm really excited for the organization to be moving towards. And so just 30 seconds before you go on with your hectic days, maybe some thought into what Indigenous cultural safety can look like in your practice.
Thank you very much, Brandy, and thank you for coming, Allison and Ilan and Jessica. That presentation was amazing. I learned a ton. I've got a lot of questions just for me, so I think I'll probably reach out to you guys afterwards, and I think a couple other people have got some questions for you too. I think it would be lovely to have you back in the spring to see how this is kind of all rolled out and how well it's going for you, because I think a lot of people will really benefit from this work. It's really moving. You guys have done a fantastic job.
Thanks for watching, everyone, and thank you for joining us on the BC chapter of the CACCN YouTube channel. We have a lot of great content recorded, and we're just in the process of cleaning up and getting it ready for YouTube, but also from previous events we've had over the past 12 months. I would suggest subscribe and hit the notification button so you can know when the next thing is out. And if you ever want to come to our next event, we're on Facebook and on Instagram. Our links are listed below. And while I'm on the topic, if you're a critical care nurse anywhere in Canada, why don't you join CACCN? We have a ton of resources to help you be the best critical care nurse you can be. Go to caccn.ca and join us.